First aid and hygiene. You should be aware of the first aid required if you're exposed to the chemicals in the boatyard. When you come into direct contact with solvents, it can cause defatting of the skin. The active ingredients in anti-foulings are an irritant and can cause skin rashes. If skin becomes sensitized, then a rash can be caused from the slightest contact with similar substances in the future. Dry paint on overalls may also cause irritation, especially if it's in contact with wet or sweaty skin. The longer paint's in contact with the skin, the higher the probability of irritation or sensitization, especially if the paint is trapped against the skin under the sweatband of a hard hat or inside gloves. With this in mind, it is important to regularly clean your protective equipment. There are no specific antidotes for skin irritation. Any rashes should be gently but thoroughly cleaned and an anti-inflammatory type cream applied. More serious skin conditions should be immediately referred to a doctor. If wet paint or dry spray gets into the eyes, then they should be washed with water or saline solution for at least 15 minutes. If discomfort continues, a doctor should be consulted as soon as possible. Any respiratory symptoms should be referred to a doctor immediately. Another significant hazard from the use of paint is possible damage to the lungs. This comes mainly from solvents, but also from paint spray particles. Solvents will affect the central nervous systems, and particles can irritate the body both internally and externally. In hot climates, a single overall worn next to the skin can become completely wet with sweat. This allows active ingredients in paint on the outer surface of the overall to be drawn through it. This results in skin irritation. To prevent this, it's recommended that 2 overalls are worn. In case of heat stress, use an appropriate single-layer overall. This should be white. It's important to maintain a high level of hygiene while working with hazardous materials. Before smoking, drinking, or eating, the team should wash their hands and face thoroughly. Transfer of irritant materials to areas of skin which are more delicate than the hands can be very unpleasant and is to be avoided. After working, or as soon as possible after coming in contact with wet paint or dry spray, the application team should take a shower. These staff should not change into other clothes without having a shower or go home in working clothes. Food and drink should not be prepared or taken into spraying, storage, or mixing areas. Hand washing facilities and other amenities should be provided for use on site. The amenity room should be kept free of all the hazards associated with spray painting operations and be kept free of all potential contaminants.